I am Dr. Rajesh Vasu, Plastic and Aesthetic Surgeon at Illumina, Star Hospitals, Nanakramguda. In this episode, we are going to be discussing about breast ptosis, which is very common in a section of our Indian women. And we're going to be discussing what is the cause of breast ptosis and what are the various treatment options. So let us first see what is breast ptosis. Ptosis is nothing but, in layman's words, sagging of the breast. Now, sagging of the breast can happen because of many reasons. The most common reason being post-pregnancy. Once a woman delivers and once the effects of the hormones wear down, what happens is there is no support to the breast, and because of this, the sagging starts. And it happens up to a period of 6 to 9 months, and then the breast settles down finally into a very low position. So pregnancy is a very common cause of ptosis. Now the other reasons why the ptosis can happen is because of post-massive weight loss. So a lot of women are into fitness regimes, are into diet regimes, and because of this there can be a loss of weight loss. And you know that once there's a loss of fat depletion, fat is actually a support. Now once the fat goes, the breast has to drop, and this causes ptosis or sagging of the breast. Now we have to understand, first of all, a person may not know what is ptosis and what is the grading of ptosis and whether she may require surgery or not. So for this we need to understand the grading of ptosis, whether one has to go for a breast augmentation, one has to go for the other methods of treatment of correction of the sagging breast. So let us understand on this mannequin that if you see this mannequin, this is the position of the nipple areolar complex, and if you see that there's a fold over here, there's a natural fold. Now usually in normal women, the nipple areolar complex or the nipple lies 3 centimeters above the fold. So that's a natural location. So that means that there is no ptosis absolutely in this kind of breast. Now we call it grade 1 ptosis or sagging when the nipple actually drops down to the level of the fold. So when that happens, it is called as grade 1 ptosis. Now when the nipple falls below the fold but still you can see the contour of the breast, that becomes grade 2 ptosis. And in very severe cases, you can find that the nipple drops to the lower contour of the breast and absolutely no visible breast seen below the nipple. That's grade 3. The reason why I'm saying these grading systems are important is because that determines your surgery. Unfortunately, surgery is only the option for these women, and it's because of the surgery you can actually restore the volume as well as the shape of the breast. So this is possible in a ptosis correction. And we'll discuss now what are the various types of surgeries which one wants to do to correct these sagging breasts. So usually after pregnancy or post-massive weight loss, the concerned woman will notice that the breasts are actually sagging. There is a loss of volume as well as there's a deformity of the breast, and the entire breast may not look like it was before the pregnancy or before the weight loss. So because of the deformation, they seek these corrections. Not all women having sagging breasts may prefer surgeries. For those who are actually seeking non-surgical methods, there are a couple of methods which are actually in vogue and where our patients can have a subtle lift. So what are these treatments? One is a thread lift. Now these threads have come into vogue for over the last couple of years, and these are dissolvable threads, but they can actually lift the breast to a certain extent. And these are applied from below the collarbone and they're passed under the skin, and because of this special nature of the threads, they have cogs or something like hooks which engage the underlying tissues, and you can literally lift the breast to a certain extent. But beware that this elevation cannot be of a massive or cannot be so much that you'll be able to appreciate the benefits of the thread. Threads can only increase it by a few millimeters, and after a couple of months it can actually revert back to normal state. So not very, very helpful, but those patients who are really scared of surgeries can consider a thread lift. Now again, of late there are some radio frequency technologies which are in use by plastic surgeons, and this is nothing but heat energy which is passed under the skin, and when the heat energy is delivered, it kind of contracts the skin and lifts it by a couple of millimeters, and thereby making the patients seem somewhat happy. So these are the two methods which one may restore to, but again beware that it's only going to increase the lift by a couple of millimeters or at the most a centimeter or so. Now, after having dealt with non-surgical procedures, the main focus is on the surgical procedures, because this is what gives the natural lift, this is what gives a better result, it gives a better shape, and you can also have a better volume. Now, there are many methods which are really done by plastic surgeons for correcting the ptotic breasts. Now, let's go from mild methods, that is less invasive methods, to more invasive methods. Now, when we talk about, let's say we talk about a mild ptosis or a grade 1 ptosis where the nipple is just at the fold. So in this method, in this ptosis, we can actually consider an implant. An implant would just do the trick, and you would get a better result or a lift with just an implant, because the implant is creating the volume. At the same time, because of the implant being inside, it's going to lift it by maybe 1 to 2 centimeters. So a breast augmentation is a fantastic way of addressing a very mild ptosis. Now, taking away the breast augmentation, you also have another method where you make a scar around the areola, and this is called the circumareolar method. Again, a very popular method because the scarring is very minimal. You're not actually scarring the other parts of the breast. So this technique, you can actually lift the breast for up to 2 centimeters. So let's say the nipple areola is sagging like this. For 2 centimeters, you can actually lift it to the desired element by actually cutting all across and again doing the corrections and making the lift. Now, in patients who have moderate ptosis, there you would probably require a circumareolar and a vertical reduction. So here what you have to do is, there's a scarring is a little more extensive. It's called the lollipop method because this is the round and this is the stick. So that's why it's called the lollipop method, where this much amount of scarring is expected, but it is very, very minimal in the post-operative period. There are a lot of methods to actually correct that. In this method, seriously, you can actually there's a lot of shaping which happens, and also at the same time, you can volumize the lift by placing an implant. Sometimes even surgeons can correct it with fat injections. So there are a lot of options to actually volumize the breast. You can use fat injections for a very subtle correction. You can also use implants for volumization. So that is the advantage of this. Now, there are patients who have very severe sagging and who have a lot of excess in the horizontal extent. So there, the extent is not just the lollipop, the vertical limb here, but you also get the anchor scars over here. This is a little more extensive, but if you have to correct a very severe ptotic breast, one may expect that they may have scarring like this, like an anchor-shaped scars. And this is for the very severe ptotic breasts.